Our pathogen project is on streptococcal pharyngitis and diphtheria. Streptococcal pharyngitis is a bacterial infection of the throat, which can cause it to feel scratchy, sore, and transmission through respiratory droplets. A causative agent of streptococcal pharyngitis is an infection of the bacterium called Streptococcus pyogenes, which is a part of group A streptococci. They are gram-positive cocci and are arranged in chains. They form capsules but are non-motile and do not form endospores. Descriptions of diphtheria include a contagious bacterial infection of the respiratory system. The causative agent of diphtheria is Corynebacterium diphtheria. It produces an exotoxin that can cause severe damage to the respiratory tissue. It is gram-positive, non-motile, non-spore-forming, and the cells do not produce capsules, and it is shaped in pleomorphic coccobacilli. Some biotypes include gravis, mitis, and intermedius. C. mitis is usually a mild form, C. intermedius is an intermediate form, and C. gravis processes a more severe form of the disease. Signs and symptoms and progressions, if untreated, of streptococcal pharyngitis include fever, difficulty when swallowing, red and swollen tonsils, sore throat, swollen lymph nodes, red spots on the roof of mouth, and white patches or streaks of pus on tonsils. If it is left untreated, it can cause inflammation of the kidneys, scarlet fever. It can also cause rheumatic fever, which is an inflammation that causes the heart, joints, brain, and skin to swell up. Some signs, symptoms, and progressions, if untreated, of diphtheria include sore throat, swollen glands, difficulty breathing, fatigue, difficulty swallowing, and also fever. Breathing difficulties occur when the thick gray membrane coating of dead tissues builds up in the nose and throat. The gray membrane is called pseudomembrane. Toxins from bacteria can enter through bloodstream, causing heart damage, nerve damage, kidney damage, and possible death. Toxins kills healthy tissue in the respiratory system. The route of transmission for streptococcal pharyngitis include airborne droplets, being around people who are contaminated with the bacteria, skin contact with someone who is also infected with the bacteria, and consuming contaminated food. The route of transmission for diphtheria include respiratory droplets that are spread from person to person from sneezing and coughing. Skin-to-skin contact with a person who has been infected could also cause spreading of diphtheria. Some available treatments for streptococcal pharyngitis include penicillin and amoxicillin, which are antibiotics. Some preventative measures you can also take includes washing your hands often, cleaning open wounds, covering your coughs and sneezes, washing utensils to prevent bacteria from spreading. And there are also no vaccines to prevent strep throat at the moment, but these are some cautious steps that you can take.
Okay, next we have the available treatment for diphtheria, starting with erythromycin and penicillin along with antitoxin. These stop spreading of bacteria, and it's also a neutralizing of the toxins. Preventions for this is very vaccine-based. They have the Tdap for single doses of adolescents and pregnant women for every pregnancy. The DTaP is usually for children, and that's 5 doses. And then the Tdap, again, protects against diphtheria, tetanus, along with pertussis. And then TD protects against diphtheria and tetanus. Next, we have the prevalence of streptococcal pharyngitis. Over the past decade, Group A strep infections have been increasing in the United States. We do have common around high seasons, which are said to be December through April. The number of strep infections exceeded since pre-pandemic. We do have 20,000 to 27,000 cases each year and deaths of 1,800 to 2,400. These rates have increased in adults ages 18 to 64, mostly in people experiencing homelessness and drug use. The prevalence of diphtheria There has been 8,819 cases of this reported in 2017 worldwide, the highest it's been since 2004. About 9,334 cases of these were compiled from 32 different countries, starting from 2000 to 2017, which is a 37 increase since 2004. Southeast Asia has been reported the most incidents of diphtheria, specifically from India, Nepal, and Indonesia. In the data collected, about 65% of these cases were of unvaccinated individuals. Most of the patients in the case were over the age of 15, and we do have some of these social factors that contribute to higher cases, which is social disruptions and higher conflicts, such as Bangladesh, as an example. A case study of streptococcal pharyngitis is a 6-year-old boy being admitted to the emergency department with severe throat pain and a fever. They performed a physical examination and resulted in streptococcal pharyngitis. They did see some swollen uvula, the spots there that you can see in the picture. Their treatment, they went with penicillin and a topical Angelizia. And then antibiotics were used to reduce the risk of that fever, meningitis, endocarditis, and or this abscesses. An outbreak of diphtheria. In the 1990s, there was a massive emergence of diphtheria in the former Soviet Union. These factors were adults being decreased childhood immunizations with low socioeconomic status and high population movement. We did have 140,000 cases reported and 4,000 deaths reported. Vaccinations were used to control the epidemic. In 1996, 20,215 cases were reported, with a decrease of 60% since 1995, and 6,932 cases were reported in 1998. An interesting fact that we have here for streptococcal pharyngitis is 15 to 20% of children tested will show a positive result for strep throat, regardless of the lack of symptoms. Children have a small trace of strep that continues to live in their throats, but is not harmful or pose a threat. And then our interesting fact for diphtheria, the name for the disease came from a French physician named Pierre, who called it diphthyrite. It is derived from the Greek word for leather or hide, which is supposed to describe the coating in the throat that we see in this disease. Some questions that we have for you is, how is streptococcal pharyngitis transmitted? We have a true or false, which is streptococcal pharyngitis form endospores. Is that true or false? And how does the cytomembrane in diphtheria affect the throat? And what are the biotypes of Corneobacterium diphtheriae and its severity? And then our references, and that is it.